In this video, I want to introduce you to health psychology. Now, this isn't supposed to be like a advanced graduate type collegiate introduction. This is here's what health psychology is all about to somebody who's heard the word health and heard the word psychology, but never heard them together. So we'll talk a little bit about what health means and what psychology means, and then what the discipline of health psychology is all about when put together, and a little bit about what that looks like today. So this is intended for somebody who may find themselves in a health psychology class, wink wink, not really knowing what to expect or knowing what it's all about. So my name is Patrick Whitehead, and I teach psychology at Albany State University, and I do teach a health psychology class. I have written books on health psychology, but I invite my students to explore any aspect of health, well-being, or quality of life that is pertinent to them, but they have let me know that they're also curious about what health psychology is all about, so it's for those students too. To define health psychology really quickly, I want to point to the hospital or the clinic or places where medicine is practiced, particularly in the Western world. And when I say Western world, I mean conventional medical practices based on medical science. So places where you go to get surgery, or places you go to get treatments for diseases or infections or problems with your body, things that medical scientists specialize in. So you go to a hospital, you go to a clinic, experts see you, but what they do is not 100% biological. When I say biological, I mean dealing with organic chemistry in the body, dealing with cells, cellular division, tissue, organs, things like that. You are not just the cells that make you up. You are also a person. You have a personality, you have relationships with people, and these things cannot be predicted by your cellular makeup. So physicians specialize in parts of tissue, they specialize in organ systems, but there's aspects of who you are that they can't touch, or they're not trained to touch, and we need a different specialist for them, and that's where health psychology comes in. So let me give you a really simple example. I think simple. Well, I guess when it becomes an example, you realize how complicated the practice of medicine is. So let's say you've got lower back pain. And so you've been struggling with lower back pain, you're uncomfortable driving for long periods of time, you can't stand for more than 2 hours without becoming uncomfortable. Eventually it gets so bad that you have to go see your general practitioner, your general provider. And so they do an examination, they rule out any simple possible causes, and then make a referral to get maybe an x-ray done. So you get an x-ray of your lower back after they check hormone levels and blood tests and things like that. And they find that you've got a tumor along the side of your spinal cord. It's like, oh, I've got a tumor. So you go see an oncologist, maybe your neurologist if it's close to your spinal cord. But the oncologist is a specialist who deals with cellular divisions and cancerous growths, things like that, and maybe can make a decision whether or not surgery is possible, give you a prognosis for how long you'll survive, whether it's metastasized, become more of an issue. In other words, they'll make a cancer diagnosis and then give you pathways forward for treatment. So you say, okay, and you choose one. But that's not where the story ends, because in order for the surgery to go well, they need more than the oncologist and the surgeon's hands and knowledge. They need your preparedness to go under the knife. If you don't trust your oncologist, if you don't trust the surgeon, if you feel like it's evil to cut into a body, so your religion prohibits anyone from cutting into you, you will the surgery will not go well. Part of the surgery going well is the patient's acceptance of what's going to happen, their trust in the surgeon, whether or not they think it will work. All of these psychological components have proven important in the actual practice of medicine. So going back 50 years, it was just look at this inexplicable phenomenon, but it's become so common, this role that psychology plays in the practice of medicine that a new discipline has emerged called health psychology. At first, it was called different things. Like one example was cardiac psychology, and so this is when cardiologists who work with the heart realized that there was more to fitness, physiological or cardiovascular fitness, than the body working out. There was also, I'm sure you've heard of type A personality and type B personality. Type A personality, like everything has to be perfectly right. So like you can see my hair is disheveled. I am not a type A personality. I've got, look at the way that, if you were to see my office, it's a complete mess. I'm a type B personality, but if I were type A, then everything would have to be absolutely perfect, and I would have started this video like 7 different times already because I mispronounced a word or I gave an example that I didn't like. Type A personalities, cardiologists have found, are extremely more likely to have a cardiac episode. They're more likely to have a heart attack. And if they have a heart attack, they're going to take longer to recover from it. Now, how can this personality characteristic that has nothing to do with an organ inside the rib cage, how can this personality characteristic influence the heart? And it's a big question mark. It's uncertain. Cardiologists weren't sure what to say about it, other than it's an important factor. And so again, they started calling this cardiac psychology, the role that a person's environment plays, their perception of the environment plays in their own health and well-being. Cardiac psychology, by the way, you can find books written about it. They point to all sorts of factors that wouldn't make sense to a biology textbook or a medicine textbook of how somebody gets better. So like if you bring a plant, like a living plant, into the rehabilitation room of someone who's just gotten out of heart surgery, they'll recover more quickly than someone who has no plant. Or if there's like they have a window that looks onto nature, like they'll recover more quickly. Or if there's paintings up, like they'll recover more quickly. Or if they write poetry, like all of these things that wouldn't seem to make sense in the hospital have shown time and again to be important. And so again, this is called cardiac psychology, or more broadly, health psychology. So what is health psychology? Well, it's this kind of shadowed area, or this region of medical science where medical biology and the science of medicine doesn't explain everything. So backing out a little bit, if we look at the amount of money that was spent on healthcare procedures in the United States last year, 40% of those procedures were for problems that have no known biological origin. So they're called medically unexplainable physiological symptoms, or MUPS. 40% of healthcare costs were for problems that seem to be bodily. I have a heart murmur, trouble breathing, lower back pain, migraines, nausea, or feeling nauseated. All of these experienced symptoms that have no known biological origin. So if you were to have a CT scan or an X-ray or a full medical checkup, there's no reason to explain why you're feeling the way you do, but you feel that way anyway. That is an area, I think, that psychologists need to examine, using the tools and the toolbox of psychology, which looks at human experience. So again, this is what health psychology looks at. So we looked at psychology in the hospitals. What role would a psychologist play in the hospital? As a therapist, is therapy important for recovering from knee surgery? Well, I've talked to baseball players here who have thrown out their shoulder as pitchers, or suffered ACL injuries, or football players here who have had so many concussions that they can't play anymore. They're too nervous on the field, or they're too aggressive on the field. Yes, those are physical injuries, but they have psychological consequences. Or in the case of like post-concussion syndrome, there's no evidence of physiological trauma, yet there's psychological evidence of trauma. And so both of those are problems that can only be understood when a physiologist or a physician comes together with a psychologist and they have a conversation. And that's some of the research that I do. I've written a little bit about that. So we looked at psychology at the hospitals, cardiac psychology. If if we look at what this means for health and well-being, we can start to see that health is not simply a biological state. It's not like a state of being centered or like having the body in full working order. It's not just the body, it's more than that. And so one of the umbrellas that this fits into, one of the ways of describing health, is the biopsychosocial models. That's biological, psychological, and social. That these three contexts come together to explain somebody's health, someone's well-being, and for understanding health problems. So if I am chronically fatigued, so I'm always tired, I have trouble getting up in the morning, I still don't sleep well at night, or I sleep like 10 hours a night, whatever the case may be, I have trouble finishing my work, I'm just at a low ebb all day. What sort of problem is that? Well, sure, my nervous system is involved because my parasympathetic state is active when I should have sympathetic activity. So I should have energy because I've eaten food, I've had caffeine. Why am I so tired? So my body is part of this. But also the expectation that I have tons of energy. That's social. I remember during nap time in like preschool or kindergarten, I would always be the one wide awake. I couldn't sleep. And that was only a problem because the expectation was that students sleep during nap time. But if the expectation was that we went for a run, I would have been fine, and everyone else would have been tired. So like that social context is really important. We see other people that are chipper and bright, and we compare ourselves to them. That's a social thing. It's not a biological thing. So social is part of it. And finally, psychological, we realize that things that happen in our lives, losing a friend, breaking up with a girlfriend or partner, getting a raise or being promoted or finishing school or failing a test, all of these life experiences influence how we feel. Does a failed exam hurt my body? Well, no, not other than like the piece of paper, like maybe a paper cut or something. But it still impacts us in a really significant way. It impacts us psychologically, yet we experience that in our body. Like our body has a low energy or a high energy. We call it a bodily feeling, but we also realize that it's psychological too. So the body, the biology, our relationships or relatedness, that's the social, and then psychological. These three things come together and give us our model of health or well-being. And the last thing that I find interesting is the placebo effect. And so the placebo effect is the belief that something will work or not work overpowers the actual properties that would predict whether something will work or not. For example, if I have a headache, I can take an ibuprofen or an aspirin, and that will make the headache go away or be reduced a certain amount. And so I've come to rely on, for me, it's like 4 ibuprofen if I have an injury or if I have a really bad headache. So I take those and I wait, and then I expect that after an hour or so, or half an hour, it'll go away. My headache will go away, I'll feel better. How much of my feeling better can be explained by the chemicals in the ibuprofen that I just took? We might think 100%, but because that's what the ibuprofen's supposed to do. But what we've found, what physicians have found, what scientists have found, is if you give somebody 4 sugar pills with no chemicals that would make somebody's headache go away, you give it to them and they take it, and then after 30 minutes they go, yeah, I feel better. Which means the drugs they just took did not make them feel better because it was just sugar, yet they felt better. So that effect, the expectation that it would work, was enough for it to work, and that's called the placebo effect. And the placebo effect is very strong. In fact, it explains the majority of antidepressants working. So someone takes an antidepressant, they feel better. The majority of that effect is the placebo effect, but it's so strong that antidepressants are pretty common. A lot of people take them. Close to half of Americans take some sort of antipsychotic medication or medication for a mood disorder, even though the evidence shows that most of that effect is placebo effect. So too with psychological counseling. How much of that is making chemical changes or biological changes? How much of it's making social changes or psychological changes? Or is it the belief that I'm doing this, I'm doing something, therefore it should work out for me? The placebo effect is very interesting. There are tons of studies that have been done on this placebo effect. One of my favorites is the drug Ipecac, which is supposed to induce vomiting. So Ipecac is something you give to somebody who's ingested like a chemical that will kill them. You give them Ipecac and they'll throw it up. Or if they've taken too much of something, you give them Ipecac and they'll throw it up. Ipecac was used to treat morning sickness in pregnant women. So they were given a pill that's supposed to make them throw up to treat them feeling like they needed to throw up. So take this, you'll feel better. They took it, their nausea went away. It was supposed to make them throw up, but they took it and it made their nausea go away because they believed it made their nausea go away. The mind, or psychology in all of this, is very powerful. Other tests have shown that if you're giving somebody a numbing treatment, a local anesthetic, if you were to rub it on, it's not as effective as if you were to inject it, or if you were to give them a pill. Like injections, it seems so much more serious, like something's going subcutaneously. Even if it is supposed to have the same reaction, if it's subcutaneous, then we perceive it as being bigger or worse, more substantial. Have you ever wondered why drowsy pills to make you fall asleep, are like blue and green, and pills to wake you up are like red and yellow? Because the colors matter. If you take a red pill that's supposed to be nighttime Tylenol, but it's red, you're going to think, is this going to make me stay awake or make me fall asleep? It matters. It's the psychological component. So all of that is looking at the different areas of health psychology. Put them all together, you've got health psychology. As you can see, there's a lot of gaps in medicine, in like traditional clinics and hospitals, and health psychology is just starting to fill some of those gaps. But there's a lot more that it can do, and I would really be interested in hearing some of the different directions that you see health psychology going in.